What causes the hernia? Male gender seems to be the most common risk factor for a hernia. Chronic high intra-abdominal pressure due to COPD or a chronic cough, chronic constipation. Obesity is often associated with hernia. Increasing age is another component you have to think about because hernia is common in elderly male patients. Appendicectomy with an incision in the right iliac fossa or McBurney incision can predispose to hernia because of injury to ilioinguinal nerve. Weightlifting is often blamed for hernia formation, but surprisingly, professional weightlifters do not present commonly with hernia. Very rarely we blame the collagen defects as in Ehlers-Danlos syndrome, osteogenesis imperfecta, or Marfan syndrome. Now, clinical pictures of classical inguinal hernia is it's a painless inguinal bulge, spontaneously disappearing on lying down. This is the classical description given by the patient. The lump appears on coughing or lifting weight. Patient can come with pain. The pain can be a colicky pain around the umbilicus or suprapubic region depending on the contents of the sac, whether it is midgut or hindgut, due to obstruction. When it becomes strangulated bowel, the pain becomes constant. Remember, a colicky pain becoming a constant pain at the inguinal region is an early sign of strangulation. If the hernia is not demonstrable, it is mandatory that patient should be examined on standing and coughing. And coughing classically produces expansile cough impulse. Now coming to the treatment. Obviously, the imaging or laboratory investigations do not contribute to the diagnosis of hernia, though it is mandatory to do all these tests to see for the fitness of the patient for surgical procedure. Now, the surgery for hernia is classified as in various methods. It is anterior or posterior repair, mesh repair or non-mesh repair, open or laparoscopic repair. Laparoscopy can be conventional laparoscopic surgery or robotic surgery.